Assalamu alaikum. My name is Fajar Waseem, and today I'm going to talk about Tourette syndrome, which comes under the umbrella of special education. What is Tourette syndrome? Tourette syndrome is a condition of the nervous system. It is a neurological disorder characterized by involuntary tics and vocalizations, and often the compulsive utterance of obscenities. Tourette syndrome is a condition that affects the brain and nerves, causing people to make repeated movements and sounds, also known as motor and vocal tics, that they cannot control. ट्यूरेट सिंड्रोम नर्वस सिस्टम की एक स्पेसिफिक कंडीशन का नाम है. ये एक न्यूरोलॉजिकल डिसऑर्डर है, और न्यूरोलॉजिकल डिसऑर्डर्स को अगर हम मेडिकली डिफ़ाइन करें तो ये वो डिसऑर्डर होता है जो आपकी ब्रेन को अफेक्ट करता है एज वेल एज द नर्व्स फाउंड थ्रू आउट द ह्यूमन बॉडी एंड द स्पाइनल कॉर्ड. ये डिसऑर्डर ह्यूमन बींग्स को इनवॉलंटरी एक्शंस करने पर मजबूर करता है, जो वोकल भी हो सकते हैं और सिंपल बॉडी मूवमेंट्स भी हो सकते हैं. इस कंडीशन में अफेक्टेड पर्सन रिपीटेडली कोई साउंड या मूवमेंट क्रिएट करता है जो उसके कंट्रोल से बिल्कुल बाहर होती है. The main symptoms of Tourette syndrome are tics. Symptoms usually begin when a child is 5 to 10 years of age. The first symptoms often are motor tics that occur in the head and neck area. Tics usually are worse during the times that are stressful or exciting. They tend to improve when a person is calm or focused on an activity. The types of tics and how often a person has tics changes a lot over time. Tourette syndrome की diagnosis is a difficult task, especially at an early age, because tics are often mistaken as allergies, asthma, vision problems, and other conditions. About 20% of people with Tourette syndrome do not realize that they have tics. Pediatricians, allergists are among the first to identify a child as having tics, although majority of the tics are first identified by the child's parents. टिक्स यूजली हाई एनर्जी इन्वायरमेंट में ट्रिगर होते हैं, यानी कि वो इन्वायरमेंट जो ब्रेन पर स्ट्रेस डालती है. इसके अलावा टिक्स को वीडियो गेम्स भी ट्रिगर कर सकते हैं. ये टिक्स अक्सर वायलेंट भी हो जाते हैं. What are tics? Tics are sudden twitches, movements, or sounds that people do repeatedly. People who have tics cannot stop their body from doing these things. For example, a person might keep blinking over and over again, or a person might make a grunting sound unwillingly. Common tics are blinking, coughing, throat clearing, sniffing, and facial movements. अब सवाल ये उठता है कि टिक्स होते क्या हैं. टिक्स को अगर हम डिफ़ाइन करना चाहें तो ये वो मूवमेंट्स हैं जो इंसान अनकंट्रोलेबली करता है. ये मूवमेंट्स इंसान मल्टीपल टाइम्स रिपीट करता है और चाहते हुए भी इन मूवमेंट्स को रोक नहीं पाता. टिक्स की काफ़ी टाइप्स होती हैं. ये रैंडम नॉइजेस भी हो सकती हैं या प्रॉपरली फॉर्म्ड रिपीटेड सेंटेंसेस भी हो सकते हैं. कैन टिक्स बी कंट्रोल्ड? Having tics is a little bit like having hiccups. Even though you might not want to hiccup, your body does it anyway. Sometimes people can stop themselves from doing a certain tic for a while, but it is hard. Eventually, the person has to do the tic. Common tics are typically preceded by an unwanted urge or sensation in the affected muscles, can sometimes be suppressed temporarily, and characteristically change in location, strength, and frequency. When we talk about tics, so the main question that arises is कि why do the people suffering from Tourette syndrome not suppress the tics? इसका जवाब है कि इन टिक्स को कंट्रोल करना नियर टू इम्पॉसिबल है, फॉर द रीज़न कि इनको सप्रेस करने इज़ वेरी डेंजरस एंड पेनफुल. Tourette syndrome के patients explain the tics as an unwanted energy building inside the muscle waiting for a release, and when this release doesn't happen, it feels like they will explode. अगर कोई Tourette syndrome का पेशेंट टिक्स को कंट्रोल कर भी ले तो इनकी बॉडी इन टिक्स को और ज़्यादा मैग्नीट्यूड के साथ एक्सप्रेस करती है, विच इज़ अ लॉट मोर पेनफुल. So in conclusion, tics cannot be ignored. Probability of Tourette syndrome in different stages of life. The types of tics and how often a person has tics changes a lot over time. Even though the symptoms might appear, disappear, and reappear, these conditions are considered chronic. In most cases, tics decrease during adolescence and early adulthood, and sometimes disappear entirely. However, many people with Tourette syndrome experience tics into adulthood, and in some cases, tics can become worse during adulthood. Tourette syndrome के tics का ताल्लुक टाइम के साथ भी है. They are completely unpredictable in a way that we can never know if the tics will increase with time or decrease with time. This entirely depends upon the disorder, as the proper cause of this disorder is still unknown. इसके अलावा Tourette syndrome can affect people of all racial and ethnic groups. Boys are affected 3 to 5 times more often than girls. Treatment for Tourette syndrome. Although there is no cure for Tourette syndrome, there are treatments available to help manage the tics. Many people with Tourette syndrome have tics that do not get in the way of their daily life and therefore do not need any treatment. However, medication and behavioral treatments are available if tics cause pain or injury, interfere with school, work, or social life, or cause stress. Tourette syndrome often occurs with other conditions. Most children diagnosed with Tourette syndrome also have been diagnosed with at least one additional mental, behavioral, or developmental disorder like ADHD, anxiety, or OCD. It is important to find out if a person with Tourette syndrome has any other conditions and treat those conditions properly. Doctors and scientists do not know the exact cause of Tourette syndrome. Research suggests that it is an inherited genetic condition. That means it is passed on from a parent to child through genes. ट्यूरेट सिंड्रोम का इन इटसेल्फ कोई स्पेसिफिक क्योर नहीं है. इसकी वजह यह है कि डॉक्टर्स एंड साइंटिस्ट आर अनएबल टू आइडेंटिफाई द कॉज ऑफ द डिसऑर्डर. सो सिंस द कॉज ऑफ अ डिसऑर्डर इजंट आइडेंटिफाइड, अ क्योर कैन नॉट बी क्रिएटेड फॉर इट ईदर. बट अगर इस सिंड्रोम के टिक्स इंजरी या पेन इंड्यूस करते हों या डेली लाइफ में रुकावट बनते हों तो उन टिक्स के मैग्नीट्यूड को कम करने के लिए बिहेवियरल ट्रीटमेंट्स और मेडिकेशंस एग्जिस्ट करती हैं. ये सिंड्रोम एंग्जाइटी और ADHD जैसे डिसऑर्डर्स को भी ट्रिगर कर सकता है, जिनको फॉर्चुनेटली ट्रीट किया जा सकता है. ऑल्दो हमें ट्यूरेट्स का मेन कॉज पता नहीं है, मगर वी नो कि दिस डिसऑर्डर इज़ जेनेटिक. Awareness of Tourette syndrome. In the recent years, the youth has started working on shedding more light onto the topics of mental health disorders, as they were seen as taboo in the years before. Some of the most popular celebrities, like the pop singer Billie Eilish and the famous British football star player David Beckham, have spoken about the struggles of Tourette syndrome as they are both diagnosed with it. आज की यूथ ने एक बहुत बड़ा रोल प्ले किया है मेंटल हेल्थ अवेयरनेस में. कुछ साल पहले तक ट्यूरेट सिंड्रोम जैसे डिसऑर्डर्स को हेल्थ डिसऑर्डर नहीं समझा जाता था. इन डिसऑर्डर्स के बारे में किसी को अवेयरनेस नहीं थी और लोग समझते थे कि जिनको ये डिसऑर्डर है उन पर काला जादू हुआ है या दे हैव बिन पोजेस्ड बाय अ गोस्ट. हमारी जनरेशन ने यह खौफ ख़त्म करते हुए मेंटल डिसऑर्डर के बारे में इंफॉर्मेशन स्प्रेड की है, जिसकी वजह से आज लोग प्रॉपर हेल्प रिसीव कर पा रहे हैं. But there is still a long way to go until we have reached the milestone of complete awareness. Here are a few references if you want to check out Tourette syndrome for yourself. Thank you.